Hello, my name is Jessica Hernandez, and I'm going to be demonstrating skin fold testing according to the ACSM guidelines. The standard error of estimate is the standard deviation in predicting body fat from a given value of skin fold thickness. The standard error of estimation in skin fold measurements is plus or minus 3.5%. Some factors that may affect the measurement of the skin fold assessment include poor technique, an inexperienced evaluator, an extremely obese or extremely lean subject, and an improperly calibrated caliper. In order to get the most accurate measurement, you should measure your client twice. All retests should be after one full cycle, allowing the skin to regain its texture and thickness. It is important that your client is in an upright position and all measurements are taken from the right side. All sites require you to grasp the skin fold using your thumb and index finger. As shown here, the 7 sites include the chest, the mid-axillary, the tricep, the subscapular, the abdominal, the suprailiac, and the thigh. When taking skin fold measurements, the caliper should be placed on the skin surface about 1 centimeter away from the thumb and the index finger, perpendicular to the skin fold. It is important to keep pinching while taking the reading. You should wait 2 seconds before taking the reading, then release. The suprailiac is measured using a diagonal fold in line with the natural angle of the iliac crest. The abdominal fold is taken about 2 centimeters to the right of the umbilicus in a vertical fold. The chest is measured using a diagonal fold. When measuring a male, you should measure 1/2 of the distance between the anterior axillary line and the nipple, as opposed to a woman where you measure 1/3 of the distance between the anterior axillary line and the nipple. Prior to taking the measurements on the tricep, the subject should have their arms freely relaxed by their side. The tricep is measured using a vertical fold on the posterior midline of the upper arm, halfway between the olecranon and the acromion processes. The subscapular is measured using a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. By having the subject fold his or her arm behind their back allows for the subscapular to be best seen and felt easier. Then have client release and take measurement. The mid-axillary is measured using a vertical fold on the mid-axillary line at the same level as the cycloid process of the sternum. Prior to measuring the thigh, have the subject put all the pressure on their left leg, leaving the right leg relaxed. The thigh is measured using a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. Now that we have all the measurements for the skin folds testing, we are now going to calculate for body fat percentage. For men and women, the bone density calculations are different. In order to get body density, you should include the sum of all skin fold sites into these calculations. Once body density is calculated, you can now insert this calculation into the Brozek or Seri equation, giving you the body fat percentage.